Okay, so we're starting back with capillary hydrostatic pressure, and exactly what hydrostatic pressure is. Sorry, I hit too many buttons there. So there's also filtration that occurs in the capillary bed. Filtration is driven by hydrostatic pressure. So water, small solutes are forced through that capillary wall, leaving larger solutes left in the bloodstream. They can't fit out because there's no big holes for them to go through. So this diagram, I love it. I, in fact, strongly encourage you to maybe pause this video and redraw it and soak it all in. This is pretty much everything out of chapter 21 that is super important. So you have your arterial side, you have your venule side. Take a look at what's happening here. Filtration happens on the arterial side of the capillary bed. Obviously, this is a dumbed down version of a capillary bed. There'd be lots of precapillary sphincters and all that stuff going on here, but simplified so that you can focus on the action of the capillary bed. You have filtration taking place here. Why is filtration taking place? Filtration is taking place because that capillary hydrostatic pressure is pushing more stuff out, right? Capillary hydrostatic pressure is increased on the arterial end of the capillary. And because it's increased on this side, it's greater than the blood colloid osmotic pressure. It's going to force that liquid out, force all the junk out, all the waste, all the gases, all the nutrients, whatever. In the middle of the capillary bed, there's almost no net movement. On the venule end of the capillary bed, there's reabsorption. Because on the venule side, there is a reversal. Our blood colloid osmotic pressure is now greater than our capillary hydrostatic pressure. So osmotic pressure is pushing stuff into the blood. Hydrostatic pressure is pushing stuff, nutrients, waste, whatever, out of the blood. Our capillary hydrostatic pressure is pushing out all of the nutrients, all of the oxygen, water, whatever, on the arterial side. And then on the venous side, we're saying, okay, this ship's leaving. Anything that you want us to take with us, let me know. Stick it on in here because we're leaving. And that's exactly what happens on this side. So at the capillaries, it's not just, an exchange that takes place. It's filtration and reabsorption that takes place. The filtration takes place in the arterial side. The reabsorption takes place on the venule side. You don't need to know numbers here, but if I gave you a scenario and I said on the arterial end, the colloid osmotic pressure or the capillary hydrostatic pressure is 35 and the blood colloid osmotic pressure is 25, what would you expect would happen? You should say, well, hydrostatic pressure is higher than osmotic pressure, so it'd be filtration, right? So you should be able to associate, those terms together. That reabsorption is the result of, again, the osmotic pressure being higher than the hydrostatic pressure. So it's going to help pull stuff back into the venule side. So there's an interplay between filtration and reabsorption that's ensuring that the plasma and interstitial fluid are mutually exchanging ingredients and hormones and gases, etc., can be distributed equally. It's also going to assist in transporting any lipids or proteins across the membranes and allow for toxins and pathogens and things like that to get flushed to the lymphatics where they need to go. So if there's a net hydrostatic pressure, again, hydrostatic pressure is pushing water out, osmotic pressure is forcing water into the solution. And I say water, I'm meaning water and the solutes in that solution. So both filtration and reabsorption are regulated within the capillaries. So some things that are contributing to that net hydrostatic pressure are the capillary hydrostatic pressure and then the interstitial fluid hydrostatic pressure. So these hydrostatic pressures are pushing stuff out, right? That's what hydrostatic pressures do, push stuff out of the capillaries into the interstitial fluid. There's also net capillary colloid osmotic pressure, right? COP. And that's the difference between the blood and the interstitial osmotic pressure. And this is going to pull everything back into the blood. So the net filtration pressures are basically the difference between the net hydrostatic pressures and the net osmotic pressures. And that you just see that here in this little equation. Don't get overwhelmed by all of these things. This is the hydrostatic pressure inside and outside of the blood, the osmotic pressure inside and outside of the blood. That's going to give our net filtration pressure. In other words, what's going to move where, right? On the arterial side, it's filtering. On the venous side, it's reabsorbing. No net filtration in the middle. So on the arterial end, fluids moving out. On the venous end, fluids moving in. We covered that already. The capillaries are going to filter more than they reabsorb, right? So that's important. Whatever isn't reabsorbed can get sucked up by the lymphatic system, which we'll look at in the next chapter. It's kind of one of the major roles of our lymphatic system. So some capillary dynamics here in terms of hemorrhaging, major blood loss. That's going to reduce the capillary hydrostatic pressure, reduce the net filtration pressure. So it's going to increase the reabsorption of the interstitial fluid. In other words, bring everything back into the blood to increase blood volume so we can increase blood pressure and keep it up. Dehydration is going to have the opposite effect. It's going to accelerate reabsorption, or rather the same effect. It's going to accelerate reabsorption, making sure we reclaim all of that extra fluid from the tissues, right? That makes sense. If you're not drinking enough water, one of the symptoms is going to be, a dry throat or dry, itchy skin, right? If you're hydrated and you're drinking enough water, then your skin is nice and soft and moist and whatever. We know that from just living, right? An increase in colloid hydrostatic pressure or capillary hydrostatic pressure and blood colloid osmotic pressure is going to, again, push everything out of the blood, build up the fluid level within the periphery, and that could lead to edema, right? Swelling. Tissue perfusion is then going to allow that blood flow through the tissues, carrying oxygen and nutrients, all the tissues and organs, carrying carbon dioxide and waste products away. And again, that's all affected by the cardiac output, the resistance, and the blood pressure. So how well does that blood get to the capillaries, get out of the capillaries? It's all affected by how much blood your heart is pumping, how much resistance your heart has to overcome, and how much pressure is happening in those vessels that are delivering it. So there's lots of regulation that occurs, right? Regulation has to be done at the appropriate time within the right area, right? Regulation can occur just, within your right hand or just within, your left toe, or it could, be systemic. And you wouldn't want to change just because you're changing, what's happening in your thumb doesn't mean you're going to change what's happening in your liver, right? So it has to be evenly distributed and well maintained throughout the body. So this is done through autoregulation, neural mechanisms, and endocrine mechanisms. You're going to see this as a pattern. Anytime we talk about regulation in AMP2, we're going to see a form of autoregulation or local regulation. You're going to see neural regulation, and you're going to see endocrine. Those are the three ways things are regulated in the body. So autoregulation is just immediate local, all the neighbors kind of know what's going on. Neural involves the brain, right? And endocrine would be a hormonal response. It's much a long-term response with hormones because, as you know, hormones take a little longer to take effect and a little longer to wear off. So let's talk about some autoregulation here. Local vasodilators, things like low oxygen, low carbon dioxide levels, low pH, nitric oxide presence, high hydrogen ions or a low pH, right? Chemicals like histamine being released, local temperature being elevated. All of those things are going to act as local vasodilators, increasing the diameter, increasing the blood flow, bringing more blood in, more oxygen in, more, whatever in. And this is all done through our basic cardiovascular responses. I think this is another one where you should probably pause the video and redraw this, see if you can make sense of what's going on here with the autoregulation and the input of the neural mechanisms and the endocrine mechanisms when it comes to regulating blood volume and blood pressure, and make sure that you understand how just noticed autoregulation is misspelled there. How all of this is interconnected and how it affects one another. We'll stop this video here.